Tylenol, autism, ADHD. Let's talk. While we talk, let's repot. So I posted yesterday about how correlation does not mean causation. All correlation means is an association. So let's talk a little bit more. I got really good questions, some comments about what I posted. You can see them up here. Let's start by backing up a little bit, okay? There's big picture points I want to make. First and foremost, neurodevelopmental disorders are extremely complex. There are so many factors that go into why one child may have something and another child may not. And there's so much we just still don't know. Next point I want to make is no study is perfect. Any study that you look at, you have to read closely, understand, one, what were the authors, what were the researchers trying to determine? And then you have to look at how they went about it. I think I put too much in here. As we look at RFK regarding autism and Tylenol, first there's the nurses' health study. They were looking at many different things in this study. Tons of data was collected across many people. They looked at almost 9,000 children. And what they wanted to look at was, did exposure during pregnancy of Tylenol lead to or increase the risk of ADHD in offspring of these women? There were limitations in the study. There was no sibling control, so you can't really look at genetics. When they were looking at exposure, they did not specifically look at when during pregnancy the exposure occurred. And then when they looked at exposure, all they said was use 2 or more times a week of Tylenol. So it could have been 2 or it could have been 100. There's no distinction. And that's a very important distinction because then you can't look at dose dependency. And finally, really important from a clinical standpoint, didn't have data on any, if any, prescription drugs that the women may have been taking during their pregnancy. So in summary, in the big picture, and the authors themselves cite this, is that they can't rule out the possibility that other uncontrolled for factors may have influenced and played a significant role in the development of ADHD in the offspring of these women. So now let's look at the Boston cohort study. That's the Johns Hopkins. Everyone's, referring to these Johns Hopkins. However, this is the Johns Hopkins. They were looking at Tylenol metabolites levels in the cord blood, and they had a panel of these metabolites that they tested for. And what they were trying to see is presence and amount of the metabolites associated with the development of ADHD, Asperger's syndrome disorder, and other developmental delays. They had enough cord blood in about 1,000 kids. And then they were able to correlate that with maternal cord blood. And then they were able to correlate that with maternal blood metabolites in about 800 people. And what they found is very interesting. And so they find these correlations, right? And they did. They found a correlation between presence of metabolite with a diagnosis in the child of ADHD, ASD, and developmental delay. But they also found all kinds of other correlations. For example, moms who never smoked, when you looked at them versus moms that were actively smoking, the never smokers actually had a higher correlation with autism and ADHD, right? So are we going to say now that moms need to be smoking to protect their kids? No, it's a correlation. So the authors of the study looked at limitations of the study themselves as well. And what they report is that the measurement is a one-time measurement. It is a snapshot of that day, not any other times. Second, the panel that they used didn't actually measure the major metabolite of Tylenol. So a big chunk of potentially very valuable data just wasn't collected. And then finally, they didn't measure for potential confounders. Again, confounders are other factors, don't get measured, but they can potentially influence the outcome. I think I need a bigger pot. So this study looked at 46 other studies. So it didn't look at individual people, it didn't collect data directly from pregnant people, people who'd given birth, or kids. What they wanted to do was, by using a very specific type of methodology, is to rate the evidence presented in these 46 studies and try to draw conclusions from these studies, how good a quality these studies were. Okay, Now, the methodology that they use is the gold standard. The methodology was specifically designed for looking at external, occupational factors that doesn't take into consideration necessarily things intrinsic to the humans in these other studies, right? They looked at all these different factors in 46 different studies, and they looked at potential confounders. They looked at things like exposure, so exposure to Tylenol in the mom, the diagnosis, how was the diagnosis made in the offspring, and what they found out of 46 studies that they looked at, 27 had a positive association between Tylenol exposure in the mom and a diagnosis in the offspring. 9 of the studies showed no association, and 4 showed negative association. What that means is taking Tylenol was actually protective against developing one of these conditions in the offspring. Now, you could still say, well, the vast majority showed a positive, right? So then it must be that. Not necessarily. Let's look again at the limitations. When they were rating the data, the biggest problems, time and time again, were confounders and exposure. Again, other factors that were not measured that could potentially play a role, and then exposure. So how much, for how long, and when during the pregnancy. Only 1 or 2 of the studies even looked at that, and those were very small cohorts. I'm going to read you verbatim what the authors of the Harvard study said when they discussed this. We advocate cautious, time-limited acetaminophen use under medical guidance. And let's go back to the big picture, because I really want to drive home. Big picture, this is just one topic, one time where this comes up. And the big picture is much more important, and that's what I really want to drive home. Neurodevelopmental disorders are extremely complex. There are so many factors that go into how a human is made in utero and how they develop after birth. So much that we still don't understand. So you can't draw one simple conclusion, A to B, with autism, with ADHD. You just cannot. Point number 2, no study is perfect. Every study has its limitations, and you really got to ask questions when somebody makes a big proclamation. And finally, at the end of the day, the decision to use Tylenol or any medication, any therapy, is a discussion between the patient and their physician. RFK may be many things, but he is not my physician, and he is not your physician. He's just a guy who's apparently suffering from the Dunning-Kruger effect. That's the definition right there. Who made a big proclamation about something that he really should not have. Stick that in your brain worm, Robert.